Hi, thank you for joining us today. My name is Sonal Kumar, and I'm a hepatologist at Weill Cornell Medical College in New York City. Today, I'll be talking about symptoms and symptom management in primary biliary cholangitis, or PBC. One of the unique things about PBC is that it is one of the liver diseases that is frequently associated with significant symptoms. PBC symptoms can really impact a patient's quality of life, even in early disease stages. And it's important to know that symptoms don't necessarily correlate with disease activity. So patients whose liver disease is under adequate control may have significant symptoms, and vice versa. The most common symptoms that we see in PBC are pruritus and fatigue. And then, like other diseases, we can also see jaundice in patients who have more advanced disease. The other thing to remember is that PBC is an autoimmune process, and so it can also be associated with other autoimmune symptoms and other autoimmune diseases that have symptoms. So let's first start talking about pruritus. Pruritus, again, is one of the most common symptoms that we see in PBC. And although we don't fully understand the pathophysiology of pruritus in PBC, we know that it is linked to cholestasis and bile acid accumulation. We think that altered levels of pruritogens like lysophosphatidic acid and autotaxin contribute to the symptoms of pruritus. Pruritus frequently occurs on the palms and the soles of the feet, but really can be anywhere on the body. Oftentimes, patients note that it's worse at night, but again, it can occur at any point during the day. Pruritus can really have a significant impact on patients' quality of life. It can affect patient sleep, it can affect daily activities, it can affect mental health, it can affect the patient's ability to carry out daily activities, and really can have a significant impact on their day-to-day. There are some recommendations of how we should manage pruritus in our patients. First-line treatment is typically bile acid sequestrants. Patients will sometimes use this with adequate control of their pruritus, but if not, there are other second and third line treatment options available, such as opioid receptor antagonists, or there are some antidepressants that have an antipruritic effect. But sometimes the pruritus can't be well controlled with medications, and patients can be considered for treatment with plasmapheresis or even liver transplantation. So let's move on and talk about fatigue. Fatigue is the most common symptom that we see in PBC, and it can affect up to 80% of patients. Again, we don't fully understand the pathophysiology or what the cause is of fatigue in PBC, but contributing factors include autonomic dysfunction, chronic inflammation and cytokine release, sleep disturbances due to pruritus. So this can be very closely related to pruritus. Patients are up all night because they're itchy and they're scratching themselves, and then they don't sleep well, and then they're fatigued during the day. It can become this vicious cycle. And oftentimes, we can see coexistence of depression and anxiety in patients who do have fatigue as well. Fatigue is harder to manage. We don't have medications necessarily that are good for treating this. Our general strategy is to address modifiable contributors, such as treating the pruritus, if you think pruritus is a factor that's leading to fatigue. We also will try to optimize sleep habits in our patients. We'll teach patients about energy conservation techniques. Light physical activity can help. Some patients undergo cognitive behavioral therapy, or CBT, for psychological support if that seems to be contributing. And then there are some medications that are currently being studied in refractory cases. But again, we don't have good pharmacotherapy to treat fatigue, and it can be really a big issue for patients. Again, it's the most common symptom that we see. Now, I mentioned jaundice earlier. Jaundice can be seen in more advanced liver disease, in any liver disease, but also PBC. So if you have a patient who has jaundice, we really want to make sure we assess the severity of their liver disease. It can be an indication that they have really decompensated cirrhosis or significant cholestasis. The goal of treatment in patients with jaundice are to treat the underlying cholestasis. And then if they have decompensated disease or significant disease, you want to monitor for complications and address the need for liver transplant as appropriate. Some of the other common symptoms that we see include dry mouth and dry eyes, or Sika syndrome, and that's because there is autoimmune overlap with conditions like Sjögren syndrome. Again, PBC is an autoimmune condition and can be seen in conjunction with other autoimmune conditions. So patients will often complain about dry eyes and mouth as well. Management of dry eyes and mouth include artificial tears, saliva substitutes, and make sure that patients are adequately hydrated. And then one of the other common things that I see in my patient, which I sort of distinguish from fatigue, is more of a brain fog, and patients report some sort of cognitive difficulties. It can be intermittent in nature, it can vary in severity, and that's thought to be related to systemic inflammation and also cholestasis. It's not a symptom that we have very good management options for. It's really supportive care. If we can identify any contributing symptoms, we want to do that and make any lifestyle adjustments that we can for patients in order to help manage that brain fog, because that can really cause an effect on patients day to day. And really, the one big thing that I see in my patients is that it can affect their ability to work and carry out their activities of daily living. So in conclusion, PBC is a liver disease that can be associated with significant symptoms that can affect patients' quality of life. As providers, it's really important that we recognize this and assess for symptoms each and every time that we see a patient in our clinic. A lot of patients are asymptomatic at time of diagnosis, but that doesn't mean that they'll remain asymptomatic during their disease course. Again, the disease activity from a liver standpoint does not correlate with symptoms in PBC, so it's important that we always address this. And then symptom management is vital for improving quality of life in PBC patients. Patients really focus on their day-to-day activities, understandably, and we want to maximize their quality of life. And it's really important that we offer patients a personalized multidisciplinary approach in conjunction with a hepatologist, maybe a dermatologist or a psychologist if appropriate, in order to optimize patient care. And if we address these symptoms early on, hopefully patients can get control of their symptoms and lead a better life. Thank you so much for listening.